Hello, my name is Victoria, and I have been a nurse working in patient care areas for over 17 years. Today I'm going to talk to you about the correct procedure for taking a manual blood pressure. According to Liz Smith, new AHA recommendations for blood pressure measurement, manual blood pressures are the most accurate if you check the equipment before use, position patient properly, and ensure correct placement of cuff. I will go over the equipment needed, the procedure, and discuss the normal ranges for blood pressures. First, you will need to gather your equipment, which will be a stethoscope and a blood pressure cuff. Victoriafarler procedure for measurement of blood pressure recommends to check all equipment before use. You need to look at the gauge and make sure the needle is at the zero. Check the cuff for any breaks in stitching or tears in the fabric. Check the rubber tubing for cracks or leaks, especially at the connections. Be sure 3 sizes of cuffs are available: a small, regular, and adult large. To select the appropriate size cuff, the bladder width should equal at least 40% of the circumference of the upper arm, and the length of the bladder should be 80% of the circumference of the arm, but not more than 100%. Most people prefer the right arm if possible. Upper arm should be bare and unconstricted by clothing. You should be able to get at least 1 finger under a rolled up sleeve. Place the gauge so it can be viewed straight on and within 15 inches of the viewer. You're going to palpate the location of the brachial artery on the upper arm's inner aspect. Position the center of the cuff bladder over the brachial artery. Apply the cuff evenly and snugly 1 inch above the antecubital fossa, the bend of the arm. Check snugness at both top and bottom of the cuff, and position the arm so the cuff is at heart level. The arm should rest firmly supported on a table, slightly abducted and bent with palm up. For the first reading, only obtain estimated systolic pressure. Palpate the radial arterial pulse. Inflate the cuff to the point where the pulse can no longer be felt. Slowly deflate the cuff, noting on the gauge the point where the pulse reappears or can be felt again. This is the estimated systolic pressure. You're going to deflate the cuff. Wait at least 15 to 30 seconds before re-inflating the cuff. This allows good circulation to be reestablished. You're going to calculate the maximum inflation level by adding 30 millimeters to the estimated systolic pressure. So if you got a reading of 120, you would add 30 to that, which you were going to pump up to 150. Perloff also states the importance of client's positioning. This can cause inadequate readings. So you want to make sure the patient's legs are uncrossed, feet are resting firmly on the floor, and the back supported while blood pressure is being measured. Clients may need to be reminded to uncross their legs each time you're ready to take a blood pressure. You're going to insert the stethoscope earpieces, angled forward to fit snugly. Place the bell or the diaphragm head of the stethoscope lightly over the brachial artery at the bend of the elbow, but with good skin contact. Avoid too much pressure, because this can close off the vessel and distort the sound, therefore altering the reading. You're going to inflate the cuff as rapidly as possible to maximum inflation level, whichever number you came up with on the original one. You're going to deflate the cuff slowly and consistently at the rate of 2 millimeters per pulse beat. The rate of deflation should be slow enough to accurately evaluate the exact millimeter marking of the heartbeat sound. Once deflation has begun, do not re-inflate. Note where the first sharp rhythmic sound appears in relation to the numbers or markings on the gauge. This is your systolic pressure. Continue deflation at the established rate. Note on the gauge where the last sound is heard. This is the diastolic pressure. Continue deflation for 10 millimeters past the last sound. This assures that the absence of sound is not a skip beat, but is the true end of the sound. Then deflate the cup rapidly and completely. Record the readings to the nearest 2 millimeters, round off upward. This means all readings taken with non-electronic equipment will be stated and written in even numbers. Smith states normal ranges of blood pressure in adults is 119 or less for systolic and 79 or less for diastolic. According to Lippincott, the Manual of Nursing, Normal range for an adult is 80 or less for diastolic and 140 or less for systolic. If you are over the age of 65, Lippincot's manual says it can be raised to 150 systolic to 90 diastolic. People with health problems should monitor their blood pressure regularly and notify the doctor if readings are constantly higher than normal. Lippincott suggests that elevated blood pressures for extended time can cause permanent damage to the heart muscle, and it can also affect other systems in the body. In conclusion, when utilizing the proper procedures, including inspecting equipment, proper placement of equipment, and accurate positioning of patients, manual blood pressures are an effective, necessary diagnostic tool.